everyone. On today's podcast, we're going to talk with Angela Jones about having an uncomplicated pregnancy and birth when you're labeled as high risk. Welcome to the Evidence-Based Birth Podcast. My name is Rebecca Decker, and I'm a nurse with my PhD and the founder of Evidence-Based Birth. Join me each week as we work together to get evidence-based information into the hands of families and professionals around the world. As a reminder, this information is not medical advice. See ebbirth.com/disclaimer for more details. Hi, everyone. Today, I'm excited to welcome Angela Jones to the Evidence-Based Birth Podcast. Angela Jones, pronouns she, her, is a macro-level social worker by day. At all other times, Angela is wife to her husband, Tony, and mom to her son, Alistair, and their cats, Pumpernickel and Lion-O. Angela and Tony graduated from the Evidence-Based Birth Childbirth Class with EBB instructor Victoria and Michonski. Angela loves reading literary fiction and used to love traveling before the pandemic. She's joining us today to share her birth story and talk about her experience having an easy, uncomplicated pregnancy and birth, despite being labeled as high risk for multiple reasons. Welcome, Angela, to the Evidence-Based Birth Podcast.
Hi, thanks for having me.
It's so wonderful to have you here to meet you and hear your birth story. And hope Tony may join us if he's able. He's on baby watching duty right now.
Yes.
But tell us, how did you and Tony find out about the EBB Childbirth Class and get acquainted with evidence-based birth?
So this pregnancy was very planned. I had spent about a year researching OBs. At the time, I thought I wanted to use an OB, and I couldn't really find one that I liked after a year of looking. And eventually I settled for one who I felt like she listened better than the other ones, but I still wasn't completely happy. That said, I had a few friends that had given birth before me, and they told me that a lot of our local hospitals had classes that, as they put it, were a spectacular waste of time. And so I was just like, okay, well, I am going to put together my own little course. And I went on YouTube, and Rebecca, you have these videos that are the stages of labor. And when I saw them, it was just such a digestible, it was the best sort of description of what happens in the process that I had found. So I was like, well, that is a part of my own course. And then after that, I had started, so I had that in the back of my mind, and then I just started looking online, and I saw that there was evidence-based birth classes in my area. And I was like, oh, well, I have to take that, because if it's anything like those YouTube videos, that'll be a really great fit. I'm someone who really likes data. And so it was so good the way that everything was just broken out and like, this is actually what this means. And, you know, even when you were explaining effacement, I remember when you took out the jars, and that was the best, like,
oh, effacement of the cervix. I was like, okay, yeah.
Effacement of the cervix. So that's really how.
Yeah, I think I used like a vinegar bottle and a ketchup container, right? No, a peanut butter jar.
Peanut butter. That's what it was. Yeah. So, yeah.
And talk a little bit about your journey then, because with this pregnancy, like you said, it took a long time to get there. Can you share with our audience a little bit about, you know, your experiences before this pregnancy?
Okay, so I'm sort of in a usual situation, because every time my husband and I have tried to get pregnant, we've gotten pregnant right away that month. This pregnancy, but there's something that's happened each time. So we first started trying, and I want to say, let's see, I think we had just gotten back from Japan. So it was September 2019 when we started trying, and we got pregnant right away. And that pregnancy ended up being an ectopic pregnancy. So I knew a little bit about what an ectopic pregnancy was at the time, but it's something that I never thought would happen to me, because if you look online, it says, oh, this is, you know, something that's really rare. So that pregnancy was treated without me having to have surgery. There is this chemotherapy that they can do, sort of a low specific dose. It's called methotrexate. So I was treated with that. And then I was told by my OB at the time that I could, as soon as I had cleared that pregnancy, as soon as my HCG levels went to below 5, that I could just go again and try and get pregnant. So I did, and I got pregnant, but my HCG levels were low in that pregnancy. And it ended up being a loss that they were not really sure what it was. And so that happened. And then I had another sort of like a chemical pregnancy. Anyway, at this point, my OB at the time was like, maybe you should see a specialist, even though I was getting pregnant. I could do it once and I would just get pregnant if I did it during that time in my cycle. And when I saw a specialist, they were, they sort of brought up some of the data about using this treatment that I had used. And they were like, oh, we actually encourage people to wait 6 months after that treatment.
Oh, the treatment you had for the ectopic pregnancy, you had gone ahead and gotten pregnant again twice right after that. Mm-hmm.
Yes. So by the time this pregnancy rolled around, I got pregnant in early July of 2020 by the time I had all of those losses back to back to back. And by the time that had happened, I was just like, I don't know. And the specialist was like, you're getting pregnant right away. Even under those circumstances, I really don't think it's an issue. So that had happened. But then another thing that I should mention that was sort of a backdrop for this is that I had a high BMI going into pregnancy. And if you Google high BMI pregnancy, basically what you'll find is all of this information, I'm doing quotes, that says, A, you won't be able to get pregnant, which was not the case for me. I was getting pregnant really quickly. B, if you do get pregnant, you have a series of complications. So when I was in the process of interviewing OBs, deciding who I was going to go with, I met a lot of OBs that were just like, I would induce you at 40 weeks, just without even really looking at my chart or seeing that I really didn't have any health issues. I had a high BMI, but that was it. I didn't have high blood pressure or anything, high cholesterol or anything. I exercised regularly. I didn't really have anything other than that, sort of that label, that categorization. And so I had the high BMI, and then I had these pregnancy losses. And then I also had an autoimmune disorder. So I had just all of these things that were labeled sort of on. So a lot of OBs were just like, we'll definitely look at you very carefully. So that's sort of the place that I was at when I got pregnant with my son, Alistair.
So you were with an OB in this pregnancy. Was it the same one you went to when you were referred to a specialist to help getting pregnant, or did you go back to your original?
I went back to my original. The specialist only really does sort of complicated things. And what I had said, my OB was like, maybe you should try IVF. Because another thing is that I was 34 at the time, and I was going to be 35, and, geriatric pregnancy, ooh. So basically that's how it was treated. It was such a big thing. So the specialist only did really complicated things. And my OB originally was suggesting, well, maybe we do IVF. That way we skip your fallopian tubes. We can check, make sure that everything's okay, because I had these subsequent pregnancy losses. And literally, I was like, wait a minute, I feel like IVF is extreme. I've gotten pregnant relatively, not relatively, I've gotten pregnant quickly each time that I've tried. And it just didn't seem like it made sense to me. So I was like, when I had the ectopic pregnancy, I'd had it on one side. And then one of my subsequent losses, they weren't sure if it was an ectopic. They weren't sure if it was additional scar tissue that was left over. I'd had this procedure where they looked at my tubes after I had the confirmed ectopic pregnancy. So my tubes were clear in that process. My OB was just like, IVF, that's probably the shortest route. And the specialist was like, I don't know. And I myself was like, I don't know either. It seems sort of extreme. And I also felt like, couldn't I just wait until I'm ovulating on the other side and see, how that goes? And I did. I ovulated on the other side. That first month that I went to the specialist, she did an ultrasound to sort of look in the middle of my cycle to look what was happening. And she's just like, yep, I'm one of those people I get ovulation pain on the side where I'm ovulating. So I was super in tune and sort of knew when it was happening. And so she's just like, you're good to go, try. And I got pregnant right away, and I transferred back to my OB.
Okay.
Original OB.
And did you feel like you were, did they say you were high risk, or did they talk to you about your risk status at all during that pregnancy then?
My OB at the time, I ended up switching to a midwife, by the way, and did not deliver with that,
Okay.
with that OB. But yes, my original OB was just like, oh, we're really going to monitor you. And every pregnancy that you have in the future, even if I didn't have a high BMI or an autoimmune disorder, they would have monitored me because of the ectopic pregnancy and age, quite frankly. So,
okay. And
yeah.
how old were you with this pregnancy then?
I was 34, but I got pregnant at a time where I would be 35 by the time I gave birth.
Okay.
And that's how they count it.
Okay. So you start taking the childbirth class then with EBB instructor Victoria Michonski. And what was your experience like?
It was wonderful. It was so good, in part because I like using data to make decisions. And it really sort of, if you're a person like that, the class is set up in a way to sort of really feed what you'd like to do. So everything was really digestible. I feel like my husband and I bonded really well over the homework. It definitely took a lot of time. So I think our Sundays were spent doing that, but it sort of forced us to have conversations that we probably wouldn't have had until the moment, like that I was giving birth. Like, what type of role my husband would have during the process. I had sort of been focused on me, and I wasn't thinking on, wait, I'm not doing this by myself, even though it's something that's happening to my body, and my partner can play a role in supporting this. So that was really great. I really, really, really liked when you go into, in the course, this is part where it talks about relative versus absolute risk. And that was a game changer for me because it really put things into perspective for me in terms of my high risk labels. And it had me really look at data that I had seen a little bit differently. So for example, some of the stuff that I had seen about having a high BMI, it was just like your chances of gestational diabetes or this, that, the other. And it's like, wait a minute, it's not actually that high if you're talking about absolute risk. So that was really, I felt so empowered. I walked away from that class and I took it at such a good time because I took it during my second trimester. And I remember I had just made the decision to switch from an OB to a midwife. And I was also looking at sort of the experiences in the course of people who use OBs. There's so many good ones. I haven't had a great experience, but I do know there's a lot of great OBs. But just sort of the information on midwifery care and the midwives that I had switched to, they were so like supportive of like low intervention, which is what I wanted, my birth experience versus when I was with the OB, it was like, we will do all of the interventions. And it felt really good.
So you mentioned you switched practices and providers. Can you talk a little bit about what led you to do that and how did you do that?
Oh, 100%. So I was at my 20-week ultrasound. I had already had a few incidents with my original OB that sort of put me in like a kind of mode. Like, I don't know if this is going to work out. And if you remember, I had sort of settled in a way because I had already interviewed. I live in the city of Chicago. I had interviewed so many OBs and I just picked the one that I thought was the best one out of them, but I didn't really like any of them, in part because I didn't feel like they were taking me seriously as a woman. Bodily autonomy is so important to me. And for example, the OB that I started this pregnancy at, she would roll her eyes sometimes when I'd say things. So for example, I remember when I went in at 8 weeks for her to do a scan, they wanted to do a cervical exam. And I was like, why do you need to do a cervical exam? I don't feel like I need one. And so her nurse practitioner was in there and she was like, okay. And she just left and the OB came back and she's just like, of course I'm doing a cervical exam. And I was just like, okay. But there was no interest in explaining to me why it was needed. She was just like, I just need to check your cervix. Well, why? It's just something we do. It's standard. And so at my 20-week ultrasound, she came in after I'd had the ultrasound with the tech and said, oh, we'll need to recheck you at 36 weeks because your placenta is not where it needs to be. And I said, well, is there a problem? And she said, no, it's no problem. It's just a little lower than we would like it. And I said, well, why is that an issue? And she's just like, we just like it higher. And I was pretty flabbergasted because I was like, this is my body. I'm asking you as a professional to explain to me why this is something that's important. And she just wouldn't. It was sort of like, I just want you to show up and do what I would like you to do. So at that point, I was thinking, I'd had started out my pregnancy with a different doula too, actually. And I was telling her that this was happening. And she, I don't want to overstep, but don't feel like it's too late if you want to switch, is what she said to me. And I was afraid to switch because I was already halfway through the pregnancy. I had already interviewed all of the OBs. And she's like, have you considered a midwife? And I hadn't. I didn't know anything about midwifery, really. And I went to my first appointment with the practice I ended up going with. And I remember I was crying because I was just so scared. My emotions were a little high when I was pregnant. And the idea of shifting, I had already planned, like, the hospital where I was going out. I had already mapped up. It was 5 minutes from my house. I had already had sort of a vision in my head of how things were going to work. And the idea of like flipping that on its head and starting something new, the midwives delivered at a different hospital. They were in a suburb of Chicago. There were things, it was farther from my house. So I definitely went in a little bit, more than a little bit fearful. And the first thing that I noticed about them is they asked my consent for everything. Would it be okay? We're thinking that we might want to do an ultrasound just so that we have our own information, but we don't have to. Would that be okay with you? Is it okay if we listen to the baby? These are things that my previous OB never would have asked me. So it just was automatically like, we are here to advise you. We can give you a recommendation and it is your choice, whatever you'd like to do. And they asked me how I was. It was just like, how are you? How's the pregnancy going? Oh my God, the waterworks were coming though. At the time, I was just like crying, like, I'm so afraid to switch. I don't know if this is, for me, and I don't know anything about midwives. And, one of the midwives in the practice, she was just so lovely. She's like, that's okay. She's like, a lot of people switch a lot later. She said, I think you're switching at a good time. This is what you want. And she had also heard, I had heard some stories that I didn't really like at the practice I was at, episiotomies being cut without consent, stuff like that. And so when I was talking to the midwife about their practice, they were like, she let me know, we do not cut. First off, it is a rare occasion that one gets cut. Here are the evidence-based reasons why we do this. Once or twice a year, it was like fetal distress or something else. I can't remember. And I think they had cut one in a year or something like that. It was nothing like the old practice I was leaving. So yeah, it was a good switch, but it was definitely, there were a lot of emotions in making that change for me.
Mm-hmm. What finally pushed you over the edge and was like, all right, I'm going back to the midwives and I'm not going back to the OB?
It was when the OB would not explain. I knew I couldn't deliver with that OB no matter what. When they couldn't explain something or wouldn't explain something as simple as a low-lying placenta, which, by the way, it moved up by 24 weeks. I'm like, why? I just envisioned myself in labor. And during my birthing time, sort of having conversations about asking questions and having them be like, it just is. And that would very much not be okay with me. I have a history of sexual assault. And the way that my previous OB was interacting with me was so triggering for me. Mm-hmm. And she knew this about me, but I don't think she was making the connection of, I feel like you're doing things to me without informing me about what's going on. And that is bringing up stuff for me. So
definitely not using trauma-informed care.
100%.
Which I would encourage anyone who's listening, if you want to learn more about this, in episode 180, which is coming out a few weeks before Angela's episode, we talk with midwife Stephanie Tillman about why you don't have to have a cervical exam at your first prenatal visit and why it's so important to use trauma-informed care with everyone. So, yeah. So it seems like that OB was definitely not following trauma-informed care at all.
100% not. And it felt like night and day when I went to the midwives and they were just like, is it okay if we, would you like to, we were thinking, what do you think? I had never been asked what I thought. And it just felt like, wow, I can really work with this model.
Yeah. So take us to the end of your pregnancy. By this point, you'd been with the midwives for a while. And
Yes.
you said earlier you wanted a birth that didn't have as many interventions. What was your mindset like at the end of pregnancy?
My mindset at the end of pregnancy. So I'd had a very healthy pregnancy, no gestational diabetes. I was GBS negative. There were no complications in the pregnancy. So I had, starting at 37, throughout the pregnancy, I had acupuncture. But starting at 37 weeks, my acupuncturist started doing gently doing some of the induction points. And I don't know if this is why, but I had sort of started having prodromal labor at 37 weeks, and I have a family history of early full-term pregnancies, so like between 37 and 39 weeks. So I was expecting to deliver during that time. And on some level, I was completely ready. I had done evidence-based birth, and I remember in evidence-based birth, those comfort measures, I researched the heck out of them, and I had them all lined up for myself. I took a hypnosis course. I purchased a TENS machine. My husband and I practiced the pressure points. So I had sort of them lined up for me, and I was also, so I felt very prepared. And I was, in terms of the type of birth that I wanted, I didn't want to be medicated. I only wanted to have my doula and my midwife in the room. The midwives that I went with delivered in a hospital. I wanted to stay home as long as possible, probably till when I was toward that transition portion where you're, starting to feel the urge to push. I didn't want to go to the hospital until then, because although the midwives were really up on the research and they were 100%, I felt like we were so aligned, the hospital was where they deliver it was a little bit far behind in terms of the policies. So for example, the hospital where I had my son still has a policy that you cannot heat when you are a birthing person. So my plan was to just not go until I was at the very end. And because I was having that prodromal labor, it gave me a lot of opportunities to sort of practice my comfort measures. So I felt ready. I carried my son very low, so I was also feeling a lot of pressure. I take walks. I found my doula helped me find a masseuse who was fully vaccinated and was sort of seeing people in a very safe way where they wear a mask, she'd wear a mask. So I was getting massages. I was eating good food, watching dramas, reading. I was doing all of the things. So I felt really good. And I had all this practice. I kept on thinking that my birth time was starting, and it just wasn't. So it was a lot of practice. It was a really sweet time.
So tell us about your labor. How did it begin and when?
Okay. So it began on March 28th, 2021, when I was 40 weeks, when I was 40 weeks and 4 days into the pregnancy. Leading up to this time, I had, also an evidence-based birth. I had done the dates. I was eating the dates, sort of leading up. I was doing all this practice, and my husband and I had sort of a late dinner. I remember we had pork chops, Brussels sprouts, and mashed potatoes. And when I started having these waves, I thought, oh no, not this foolishness again. I'm having, I thought it was prodromal labor again. And so I just basically ignored it and went about what I was doing, sort of using the hypnosis class that I took, sort of had an eyes open hypnosis thing. And so I was using that to just cope. And I took a shower. I went to bed, and at 2:00 in the morning, I woke up and things had gotten pretty intense, so intense that I couldn't sleep. So I elbowed my husband and I just said, "Hey, I'm pretty sure this is it." And he's like, "Okay." And he rolls over and goes back to sleep. So then I had remembered, another thing that I forgot to mention, why I thought I was going to give birth a lot earlier than I did. I had lost my mucus plug at 33 weeks and 4 days. So,
okay.
Yeah. And my doula let me know, I've seen that, people lose that early, like weeks before anything happens. So don't really count on that. But okay. So back to the early morning situation where I was having waves that were super strong. My husband went back to sleep. He can sleep through anything, actually. So, and then I texted my doulas. My doulas were Heather McCullough and Victoria Michonski. And so I didn't know who was on call, and ended up being Heather at the time. So Heather was just like, okay, try to sleep. She advised like white wine or Benadryl, not white wine, red wine or Benadryl. And I didn't want to do either of those things. So I just figured I'd get in the shower and see what that would do. So I had one foot in the shower when I vomited with a vengeance that I hadn't seen since like my first trimester. It was like all over the bathroom. I cleaned the bathroom while I was in labor, and then I showered, and the showering actually felt a little bit too intense for me. It felt like it was just too intense. It was too stimulating at that point in my labor. So I got out the shower and I just sat on the toilets. I think I used the bathroom, and then I just rocked back and forth for hours, and just like coping, like as the waves, the contractions kept on coming. And then at some point, I was kind of out of my mind. And I remember my husband came in and he kind of puts his phone in my face. And I thought he was trying to let me see, because the doulas we had done like an evidence-based birth. Like at the end of it, we sort of like worked on like these little plans, and they were like, people who are not birthing people, you do the timing. Don't make the birthing person do the timing. And so I thought he was trying to let me see how close they were together. So I just was like, oh, like I just couldn't even look at it. It turns out he was trying to get me to talk to Heather. Yeah. And so after that, he's just like, all right, we're going to the hospital. And I was just like, why? Like I couldn't, because I didn't feel like I had to push. He's just like, I talked to Heather. She listened to you. She thinks this sounds active. And I was like, when did you talk to Heather? And so later I found out that phone, that was Heather on the phone. It wasn't like him, showing me
timing. And Heather's an EBB instructor too, I have to say.
Yes.
Both Heather and Victoria. Yeah.
Yes. So we went to the hospital, which I do not wish that ride on anyone. I couldn't sit. At that point, I ended up reclining the front seat all the way back and just laying on my side with the seatbelt the entire way there. We get to the hospital, and the minute I step into those fluorescent lights, that my contractions slow down to like, I think in 10 minutes each or something like that. It was nothing like the intensity. I could talk, I could have conversations. And I remember saying to Heather, Heather, I think I'm too early. This is not what was happening at home. And she's like, well, we'll get them started again. Don't worry. And I tried the TENS machine. It was also too stimulating for me. I wish I had tried that in advance, because it was a little too much for me. It felt like it amplified the sensations. And then at that point, Heather and Victoria switched off. And so I was with Victoria, and then she convinced me to get into the bathtub. After we had gone on a walk, and that didn't really pick stuff up like enough. So she's like, why don't, I get the bathtub set up, because they have one tub room in the hospital. I delivered in Evanston Hospital, and that tub is like amazing. It's huge. My husband and I got in it. Victoria had set up like twinkle lights. All the other lights were off. It was very dim. So we sat in there for hours, and I just, I rocked back and forth. I got on my hands and knees, and they still were not one on top of the other the way they were at home. So after something like 5 hours, Victoria said, how would you feel about going back home? Because these are not the type of waves that are going to bring a baby. And ultimately I said, I'd be fine with that, but I want to know where I'm at. My midwives had not done a single cervical exam on me. They hadn't even asked, because there really was no reason to. So I said, I want a cervical exam, because at this point it had been, let's see, if I just count from like 2:00 in the morning, it was about 4:00 the next day. And consistently I'm having waves. So one of the midwives checked me, and she said, you're completely effaced, but you're only 1 centimeter dilated.
Oh my gosh.
It was so hard to hear because those sensations were so intense, but it gave me a perspective. I was just like, okay, I'll go home. I went home. All the lights in my apartment were out. I remember that. My doula, Victoria, came with us, and I remember I just got in my bed. I put on a big t-shirt. I got in the bed. My cat Lion-O laid down next to me, and Victoria was on the other side. And she just like sort of sat there with me while I just, laid down on my side. And when I woke up, I don't know what time it was. I didn't look at a clock the entire time.
So you were able to kind of sleep and rest at home?
I was told I looked restful. I felt like I was wrestling. I rested more than I did under the fluorescent lights of the hospital, but not as much as I did in the bathtub. So I was laying there. I didn't feel like I was resting, though, because the sensations were so intense. It was just this active thing. So I couldn't sleep, really. I just lay there with my eyes closed and sort of used hypnosis to just cope. So it's hard telling the time frame precisely, but it was very dark when things picked up with a serious intensity again. They weren't right on top of the other, but they were probably like every between 3 and 5 minutes apart. And it was that way for a while. And then I went, Victoria was trying to feed me like a cracker. I was not tolerating any food. If I had a cracker, I'd throw up what looked like a cup and a half of stuff. Very little liquid, although Victoria was on it. She had my water bottle, and she was just this and an electrolyte beverage. Her and my husband were offering it to me, and I could have like teaspoonfuls. So I had some fluids, but I hadn't eaten really because I just couldn't tolerate it. And Victoria convinced me to get back in the shower. I did that. And at some point, early in the morning, probably 24, 25 hours from the beginning, it became a different experience. And I couldn't form complete sentences. And some of the things I remember saying, like, I couldn't articulate, but I was saying things like, hospital. And I was screaming it, hospital. And then ambulance. Victoria just came and she looked at me and she said, yes, Angela, you don't need an ambulance. You're coping very well. And I would rest in between, and I'd have to be at that point. I had to be on hands and knees for every wave. And then I kind of collapsed. So it was just like that for a while. And then I started realizing how tired I was physically. And I felt like I just need to eat. I need something to eat. And applesauce wouldn't go down. I had little honey sticks and those little stingers. Couldn't do it. I couldn't chew. It was hard to swallow anything that wasn't like the consistency of water. And I could only do a very little bit of that. And so I said to Victoria, I want to talk about my medical options. And I said, I'm so tired, and more than that, I want to know where I'm at this point, because I feel like that'll help me. And so we called the midwives, and she said, well, how about this? We see if the tub room is open, and if it's open, we go back in. And we called, the tub room was not open. And I was just like, at the time, not so much because of the sensations, but because of the lack of food and a lot of liquid, I felt like I was dying. And looking back, it was really that more than the sensations themselves. I was shaking a lot, and I had prepared for this, but I thought by saying you might shake, I was going to have a little handshake. This was a full body, violent, I cannot move because I am shaking so hard shake. That was something that I didn't anticipate. It's completely normal, but at the time it didn't feel like it. And so around that time, Victoria, because we live in Chicago and the tow trucks here are really active, she's like, I think I hear a tow truck. And sure enough, she looks out the window. Her and my husband are about to get towed. So they had to leave me in the middle of my labor and rescue the cars. And ultimately, I decided, I want to go in and at least see where I'm at. And when I go in and my midwife checks me, I was at a 4 with an easy stretch to a 5. And at that point, I just remember saying, okay, I can't do another 24 hours of this. And I fully knew it could be 1 hour. from that point. I was already fully effaced. Victoria had said, why don't we do some practice circles? Or she'd help me try a few different positions, but they were so intense. Anyway, so we get to this. My midwife said, okay, I have an idea. Why don't we try an opioid? And I remembered from evidence-based birth that opioids are not great. People don't report them as being the best pain relief, but I thought maybe I might be able to rest or something. So I get dilaudid at that point. And at that point, it was about 31 hours in. And everyone's different. For me, it did absolutely nothing. I was told I looked very peaceful, but honestly, I was you hear stories about how when people are executed, on death row, they give them something to paralyze them so you can't really see what's happening. That's how I felt like the opioid functioned on me. I was in there. I looked really calm, but I didn't sort of have the energy to verbalize the way that I wanted to. And so I was just this is doing nothing. I do remember saying that. And I said, I want an epidural. And they basically ignored me. It was I had already lectured my midwives endlessly about, I don't care what I say, I don't want an epidural, So they were just all right, let's just let her chill for a minute. And then at that point, my water broke and I saw that it was sort of a dark green color. And I was oh no, because in the hospital, I just knew for that particular hospital that they might react strongly. And it was almost the nurse who was there. She just said to me, okay, I saw your birth plan. We might not be able to delay cutting the cord if there's fetal distress. And it was I was about to be well, if my child looks okay, I'm not consenting to you cutting the cord or something like that. And Victoria it's she read my mind. She said, this is a post-term baby. I think this just means his butt works. And then, so after I asked for it a few times, I didn't feel I was coping well. I was just extremely tired. And I didn't, in my mind, I had thought, okay, pushing, a lot of people push between 2 and 5 hours. I didn't have the energy to push for 2 hours at that point. So I asked for the epidural again, and they brought an anesthesiologist again who was just lovely. She was pregnant herself, and she said to me, okay, just so you know, you're still in control. We can always stop it. We can bring it up, or we can reduce it. So don't feel like this is the end. And when she said that, I felt so empowered. And so she does the epidural, and it didn't start working right away, which is another thing. I was oh my goodness, I didn't realize it wouldn't start working. So I got it. And eventually I did feel well enough to rest. And automatically though, as soon as the nurse left the room, I'd been talking to my midwife and Victoria. As soon as the nurse left, I'm to my husband, I'm please bring me my snacks. And I ate, I think it was some pork rinds and some crackers or something, but it felt like the best meal of my life. And I went to sleep, and, about 8 hours later, I was sleeping. My midwife said, do you want me to check you? And I said, yes. She checked. I was 10 centimeters, and my doula came back, and my midwife said, I'd like to look again. And she looks, and she's oh my goodness, your baby's right there. Feel him. My son had shimmied his way down in the 5 minutes it took her to set a few things up. And she's do you want a mirror? And I figure she's going to bring me a handheld mirror. She brings out this giant, full body length on wheels, Snow White mirror. And I was able to just look and see my baby's head. And it was so motivating at that point. I had slept, I had eaten. The epidural really allowed me to do both of those things. And I felt so good. And I pushed him out in a little over 30 minutes. I felt euphoria like I've never felt in my life. I thought, it's funny because I had plans on something completely unmedicated. I got everything that I wanted in the end. And I felt so good and so empowered. I was able to push. I didn't want to push on my back. I didn't have to. They just said, how would you like to push? I said, I'd like to push on my side. I was able to do that. And also I felt it. I thought I was going to be numb, and I sure wasn't. And so my doula was so great. She's because I wanted him out. It was like so intense. And my doula said, the fact that he's not coming right now is a kindness on your body. And when she said that, it sort of put things in perspective. She's like, little pushes. And so all of my strength, I like summoned all of the Pilates training I'd ever done in my life. And I did like these micro pushes, like a bunch of little micro pushes to get him out. And I ended up just with like one teeny tiny, like I had one stitch, it was really a great experience. And when I saw him, my husband was able to help deliver him. We did delayed cord camping until the cord was white. It was just me, my doula, my midwife, and one nurse along with my husband. That's who was there. The room was dim the entire time. It was just such a beautiful experience. Hearing my baby cry, I will never forget that moment. And I nursed him. I just stayed there for hours before anyone else even asked. I mean, the nurse came by and said, do you want a hat? And I said, nope. We just did the skin to skin. And again, I nursed him, and we relaxed and we talked and we joked, and we just sort of processed the experience with my doula and midwife. And it was the best time. I felt so good about it. And I felt so good. I'm going to be riding that high for the rest of my life.
Aww.
Yeah.
It's amazing. And
Yeah.
what a gift that was, that you were able to sleep and eat so that you could, be re-energized and refreshed and could actually be present and enjoy the birth of your baby.
Yes. Oh, yes. One of the things that I really got from the evidence-based birth class is that epidurals are not a bad thing of themselves. They're a tool. And I think I really used it as a tool for my birth really effectively. I was able, I really didn't want to have a really prolonged pushing phase or anything like that. And it was sort of a strategic decision on my part, because I thought I was thinking about pushing and how can I get myself, I wanted to sleep and eat. And I was like, how can I do that? What can I do that's going to allow myself to do that? And I was like, okay, the opioid wasn't it, but maybe the epidural was, and it was. Yeah.
Yeah. You talked about eating after the epidural. In a lot of hospitals, that's, quote, not allowed. So how did you manage that? Did you only eat when medical staff weren't in the room, or were they aware that you were eating, or how did you handle that?
Yeah. So I already felt empowered. If they were in the room, they left me for long periods of time. COVID, in some levels, was a blessing in that way. I had also let them know, no students anywhere around. I wanted the team as small as possible. And it was really just my midwife and one nurse, my doula, and my husband. Had they said something, what are they going to do? Rip the food from my hands? But they were gone most of the time. It was just, my people in there.
You brought your own food supplies so that you could feed yourself.
I sure did. I curated a whole list of snacks, and I was eating them as soon as I could. Granted, even with the epidural, I didn't tolerate, I was only able to eat very little bits. I still was throwing up after the epidural, but I was able to eat and take down much more than I was. Mm-hmm. I could have nothing.
And I'm assuming the IV fluids they gave with the epidural might have helped a little bit with your dehydration as well. Oh,
yeah. Well, I didn't want too many of them because I've heard they can inflate the birth weight and different things. They were pretty respectful of that too. I just had, I think, 1.5 bags of fluid there. So it wasn't a ton, because I was just I do not want, a lot. They were very respectful. But yeah, the hospital did have the policy of no food. But I went in, I felt, again, evidence-based birth was so empowering. I was just I'm eating. The evidence supports this. There's no way. And I knew the reason why I was struggling is because I hadn't been able to eat. It just, my body wouldn't let me.
Yeah, that's awesome. And for our listeners who want to learn more about the evidence on eating when you have an epidural, you can go to evidencebasedbirth.com/eating, and you can see the same article that Angela read during her class. So you had this amazing birth story and a healthy baby, and you got through it with no complications.
Yeah.
Despite having multiple high-risk labels.
Yeah.
Yeah. What was your postpartum experience like? How was your recovery?
So physically, I had no recovery. I felt like I could do a cartwheel the next day. I remember the nurse, when I went upstairs in the hospital to sort of stay, first off, they told us we could leave. And I was just I wanted to. And my husband's maybe we'll just stay just to let them check the baby out and stuff. So I was fine, we'll stay. And physically I felt fine. Like I took a mirror and I was trying to look for where she put the stitch, but it was so small. I couldn't really see. So I didn't really have physical pain other than my uterus contracting after. So immediately I didn't have that. But I will say psychologically, once I got home from the hospital and I looked at my baby and he just is so cute. He's so beautiful. I'll grab one of his birth announcements real quick. He's so cute. I was looking at him and thinking about, well, I have to protect this human being. And initially I was a little overwhelmed with that idea, just as a Black family, and just thinking about how Black men and how little Black boys are not always treated very well. I was sort of overwhelmed with that thought. And then I started thinking about, the community that my husband and I have, and all the Black men that we know that lead very full lives, and just even my husband, like just how much love we have. And that sort of like strengthened me through it. So that was a little bit difficult, but ultimately I was able to pull through. The part that was hard, it was the sleep deprivation. Mm-hmm. So hearing you're going to feed your baby every 2 to 3 hours is not the same thing as doing it. And it's not like you fall asleep right away as soon as your baby unlatches if you're breastfeeding. And I am exclusively breastfeeding. So that was such a challenge. And I hadn't planned on having any postpartum support, really. We just agreed that my husband was going to do the cooking. He was tired too, though. Yeah. We were both very tired. And I ended up sort of calling Victoria in a panic about a week and a half in, I want to say, just like, I think I made a mistake. I need help. And she was booked up, but she was able to sort of connect us with an amazing postpartum doula who she would just come over and hold the baby while I napped. And she showed my husband a lot of things, like how to do pace bottle feeding. So I was able to pump once at night, and my husband would be able to do one of the feedings, so I could get about 6 hours at night of sleep, and that made a world of a difference. So I definitely had some bumps in my postpartum journey, primarily related to just like the social context of our identity, and then also sleep deprivation. Other than that, it's been great. My son is the light of my life, and I just love him so much.
So I know you came prepared with a question for me. Do you want to ask your question?
I do want to ask my question. So I'm wondering if anyone sort of in a serious way has collected, if you go on Reddit, you'll see lots of stories and other websites like that. But I want to know, has anyone collected data on favorable birth outcomes for people who have multiple high-risk labels in a traditional medical model? So if you look at the things that I had, previous pregnancy loss, high BMI, over 35, autoimmune disorder, it sort of is like the cocktail for don't even try to have a baby. And I think I gained 20 pounds during my pregnancy, and within 7 days I lost it all. I had literally no complications. So I'm wondering is there any data that doesn't say, for me, even as a Black woman too, it's like you are going to die if you try to have a baby in this country. That's basically what it looks. So I'm just wondering, not only for Black women, but just in general for people with high risk label on them for multiple factors, is there any data?
Yeah. So good question. Mm-hmm. I will tell you, as a researcher, coming from that background, my understanding is that most researchers are trying to predict bad outcomes. They don't like to try and predict good outcomes, sadly, because they're trying to see, what are the things that put you at risk. And, one of the terms that might be helpful when you're looking for specific studies is you're looking for like prediction model. So you're looking at, trying to predict, that's what researchers call it, trying to predict who might have a complication. So I was not able to find any studies from the framework of like what predicts a good outcome, or like what percentage of people have a good outcome. They usually report what percentage of people have a bad outcome. Like it's very negative. And that's just the way it's done, sadly. Risk in general is an interesting concept because there's no standard definition of low risk or high risk. Like, there's not, I can't go point to this is what, quote, a high risk person would be. There's no definition. at least in the United States. There is a definition in the United Kingdom and perhaps some other countries. But also risk is dynamic. It can change throughout pregnancy. So as times change as well, like over time, they've added more risk factors. So I'm not sure if it's really truly definable. Researchers argue whether or not high-risk pregnancy is definable. But almost all the time, when they're talking about risk, they're referring to the risk of preterm birth and the potential for potential illness and or death of the fetus or newborn. And they're not necessarily referring to the risk of the mother to experience illness or death, which is interesting. Obstetrics is very focused on the outcome of the fetus, at least the research is, or the outcome of the baby. Less so focused on what is the health of both of them together. So I found one study to use as an example. We found this study when we were looking at the research on pregnancy age 35 and older, which we've been talking about a lot recently. But there was a study published in 2018, and the last name of the author was Sheen, Sheen. And they were actually looking at maternal outcomes. So they were looking at severe maternal morbidity, in other words, the risk of severe complications for the pregnant person. And that included a long list of things like heart attack, kidney failure, eclampsia, sepsis, shock, hysterectomy, needing to go on a ventilator, along with other similarly severe health problems. And so this study was focused on how risks for these severe maternal outcomes may increase with age, but they were also looking at other health factors which they call comorbidities, to see how that influences the results. So they were trying to tease out whether age alone increases the risk of maternal morbidity, or if it's due to the health conditions or comorbidities that increase with age. So you're more likely to have high blood pressure as you age. You're more likely to have diabetes, type 2 diabetes as you age. So they used a large database with more than 36 million U.S. births to look at this question, and they grouped people into different age categories, and then they looked to see how many of them experienced severe maternal morbidity. And then they also looked to see if other health conditions you had affected the rate of severe maternal morbidity. Again, they're trying to predict a bad outcome, but we can take the data and turn it around and look at good outcomes. So I'll show you that in a minute. So they found that the risk for severe morbidity was highest in people aged 45 and older who were giving birth. So from the years 2012 to 2014 in the U.S., the risk for severe maternal morbidity was 3% for people age 45 to 54, and 1.5% for people age 40 to 44, and 1.5% for people age 35 to 39. And even after controlling for other risk factors, the risk of severe maternal morbidity did go up with age. But when they controlled for comorbidities, the risk went down a bit for all of the age groups except for younger teens. And they use something called the Obstetric Comorbidity Index, where you can score into a category of 0, 1, 2, or greater than 2. So they looked at age and your score on the comorbidity to see if you combined age and your comorbidities, what does that do to your risk? And they found out that combining older age and more health conditions does increase the risk of severe maternal morbidity. So if you were age 45 and had a comorbidity score of 0, meaning essentially you're healthy and don't have any other conditions, your risk of severe morbidity was 3.7%. But if your score was greater than 2, you had a risk of severe morbidity of 14.4%. So it goes from 3.7% to 14.4%. And then people in your age group, you were 35 when you gave birth. From 35 to 39, the risk of severe morbidity was 1.4% if you had a comorbidity score of 0 on the scale, and 8.5% if you had a comorbidity score of 35 to 30. If you had a higher comorbidity score. And they basically found what we call a J-shaped score in research, where younger adolescents and older adolescents have a higher risk. Then people in their late 20s and early 30s have the lowest risk, and the risk goes up a little bit in the late 30s and early 40s, and then it goes up really high at 45. And the risks also get higher as your comorbidities go up. But if we turn it around, the researchers didn't do this, but we talked about this, in EBB, you got to look at potential gains and potential losses. And often they only present the risk, but they don't present the chance of things going well, right? So even if you had the highest comorbidity score and you were in the age group of 35 to 39, a severe morbidity chance of a little over 8% means that about 92% of those people won't experience severe maternal morbidity. But that's not how the data are presented usually. And it's often assumed that these rates are set in stone. But you as an individual have the power to raise or lower your risk by how you care for yourself and your body during pregnancy, how you nourish yourself with the foods you eat or you're able to eat, how you engage in physical activity, how you manage your other health conditions, like are they staying managed, and also by how your healthcare provider cares for you. For example, we know that midwifery-led care can decrease the risk of lots of different complications, including preterm birth. And so I really believe how we talk to people is important. Because if you present a really disempowering picture, people are going to be less motivated to take care of themselves, leading to an increased risk. Because they're like, well, it's too bad. I've got my weight is such and such, my age is such and such, I have this health condition, so I'm doomed to have bad outcomes. But if you present realistic information and also you present some empowering information, it can help empower people to take care of themselves. So does that help answer your question about why you don't see a lot of these numbers presented in a more positive way?
It totally does. And I love the thing you did where you just turned the data around and sort of just looked at it from a different perspective. You're absolutely right that it's not frequently presented that way. And I think this sort of gives me a lens for how I think I did this like on some level with the absolute versus relative risk from EBB. But this is definitely, that's a very powerful thing, switching it around so that you're thinking about it that way.
Yeah, and it's not that we want people to think, oh, I'm not at risk for things happening, but like you give practical, real information, but you also provide people with empowering information on how we're going to lower that risk or how we're going to, hopefully help you be on that other side, which if you're looking at a seesaw or teeter-totter, that's where most people are going to land.
Yeah.
So, which is exemplified by your story. You had great outcomes.
100%. And honestly, processing the experience with the midwives in my practice, they weren't worried about me for a second. They were just like, the chances are that you're going to be okay. You're healthy. Like, they were not worried at all, despite all of the labels. And I think something that one of the midwives said to me is that it's just not what we see in practice. And that was very powerful. I think I'd already had the baby at that point, but I was just like, I was so worried. She was just like, it's not what we see in practice. Most people are okay.
Yeah.
So.
And I think if any listeners want to hear more about that perspective of midwives, not all midwives think that way, but a lot of them do. In episode 152 of the Evidence-Based Birth podcast with Shafia Monroe, who talks about traditional Black midwifery, and she talks about that spiritual aspect of envisioning, the positive outcome and how patients can feel your fear and your anxiety as the provider. And so, having confidence as the provider can be important to transmit that confidence to your client too. Well, thank you so much, Angela, for coming on the podcast. We really appreciate you sharing your story. Is there anything else you want to share with us? Or
let's see, I guess for Black women who listen to this podcast, I will say, I spent so long, doing research and trying to figure out a way that I could have a positive birth outcome. And I would just say, don't let anything get in the way of the type of birth that you want to have or the type of care that you want to have. I think, I thought I didn't have options, and I did. And I would just encourage folks to keep on looking if they're not happy with the options or the experiences that they're currently having.
Thank you so much, Angela.
Thank you.
This podcast episode was brought to you by the Evidence-Based Birth Childbirth Class. This is Rebecca speaking. When I walked into the hospital to have my first baby, I had no idea what I was getting myself into. Since then, I've met countless parents who felt that they too were unprepared for the birth process and navigating the healthcare system. The next time I had a baby, I learned that in order to have the most empowering birth possible, I needed to learn the evidence on childbirth practices. We are now offering the Evidence-Based Birth Childbirth Class totally online. In your class, you will work with an instructor who will skillfully mentor you and your partner in evidence-based care, comfort measures, and advocacy, so that you can both embrace your birth and parenting experiences with courage and confidence. Get empowered with an interactive online childbirth class you and your partner will love. Visit evidencebased birth.com/childbirth class to find your class now.